there have been multiple reports of multiple types of cancer in the scar tissue that forms around breast implants. And joining us here in the studio is Dr. Fredric Barr. He's a board-certified plastic and reconstructive surgeon here in Palm Beach County. Dr. Barr, thanks so much for joining us. Let's talk about this study, right? The types of cancers that's found in the scar tissue. What can you tell us about that?
Well, first of all, thanks for having me. Appreciate it. So far, the first issue was anaplastic large cell, and that was talked about really about 10 years ago, but really came on the scene about 5-6 years ago, where specifically textured silicone type implants were associated with this lymphoma, not from the breast, but associated with the implant itself, which has subsequently been taken off the market. That was a big deal because we really hadn't seen that before, and now everybody in the plastic surgery world is aware symptoms such as swelling, pain, something that's different. Obviously, the whole point of this is to go see your plastic surgeon if any kind of symptomatology is occurring for you. But what's recently come about, which is another cancer, although rare, 16 have been reported so far, is what's called a squamous cell cancer, and that is a cancer that forms in the lining of the scar tissue around the implant. And that's what's got the buzz at this point right now, because it really hasn't been seen. So once again, symptoms, swelling of the breast, pain, distortion, what we call capsular scar contracture, redness, these things, anything at all really. The issue is if you are having a problem, anything that's out of unusual for your implant, go see your plastic surgeon.
What if you're not experiencing any of these symptoms, right? And if someone has, breast implants, what can they do right now? Well,
again, main thing that I would like to hear from my surgeon is don't panic. Everything is okay, but it doesn't mean that we have to be nonchalant. We really need to be proactive with implants at this point. There's information out there, whether it's an anaplastic large cell, whether now it's the squamous cell associated, or even what's termed BII, which is not necessarily a medical condition per se, but symptoms that patients are having, whether brain fog, loss of hair, thyroid, pain, joint, all kinds of things. Bottom line is, not all implants are wonderful for all people. And the message here is, if you have implants, if you're considering getting implants, you really need to think through and look at what the issues are, discuss it with your plastic surgeon. That's the way things are at this point, where we want patients to be totally informed. I personally don't do implants anymore. What I am seeing is a lot of patients coming in with complaints and issues, but we, again, not to panic a patient.
Dr. Barr, I want to ask you one more. I think you touched on it as well, but besides cancer, is there any other issue that women should be on the lookout for surrounding the scar tissue? I think you talked about some of the brain fog, right? But is there anything else that we should just be on high alert if women, for example, experience anything?
I think, once again, what really needs to happen is an intimate conversation, discussion with your plastic surgeon. If you are having any kind of issue, whatever it is, don't wait. Go contact them, go in, whether they get a mammogram, they order an MRI, ultrasound. In the old days, part of the problem was we thought implants lasted forever. They don't. So the manufacturer is the first one to admit these implants do not last a lifetime. We're talking changing them out periodically. It may be at 10 years, things of that nature. I personally will take out the implant. I'll do what's called a total capsulectomy to remove the scar tissue around the implant, just to make sure that I've done everything that I know, feel good about that. I'm hopefully taking care of any of these other problems that have been coming up that we're hearing about now.
Dr. Fredric Barr joining us live today. Thank you so much for raising awareness on this topic. All right, let's check in with Michael.